Thank you so much, everybody, for being here today. And I'm Crystal Zhang. I'm the section organizer. And I'll pass the mic to the moderator, Baohua Lin.
Thank you, Crystal. Please have a seat. Move forward, please, so we can hear each other better. So our session now is locally grounded AAPI health research in North Carolina. We are really pleased to have a wonderful panel, a panelist joining us. We have one more that was landing not too long ago. Hopefully, she will make it here in time shortly. Let me introduce myself briefly, and then I'm going to ask each of the panelists to introduce themselves. My name is Paohua Lin. I'm a faculty in the School of Medicine at Duke University. I've been doing lifestyle clinical research for many, many years, and a few years ago started working with Lily, volunteering a little bit of my time in mental health research. All right, I'm going to pass the mic to Xuesong.
Hi, everyone. My name is Xuesong Han. I'm an epidemiologist and a health services researcher from the American Cancer Society. My research focuses on health policies that can affect the social determinants of health and access to care among cancer population. I did lead studies on mental health, psychological distress, quality of life, and suicide among cancer patients. But I'm here today mainly as a parent, as a immigrant, and as a volunteer for the WAVES. So I've been provide some data support for WAVES. Glad to be here.
Good morning, everybody. My name is Grace Wu. I'm a faculty at the School of Nursing and Center of Excellence for Eating Disorder at UNC Chapel Hill. My research area focuses on eating disorder symptom diagnosis, and the consequence of eating disorder such as obesity, CVD risk, and the mental health in diverse population. All of my research are community-based, especially in the North Carolina, and I've been doing eating disorder research for the past 15 years. I met Lily about 5 years ago when she enrolled in our PhD program, and I was her course faculty in her first year. And since that, we collaborate with a research focus on AAPI's mental health, sponsored by Blue Cross Blue Shield. I'm very excited, so happy to be here. Looking forward to hear all of your voice. Thank you.
Hi, everyone. My name is Liana Adrung, and I am the executive director at the Monsignor Association of North Carolina. We are in Greensboro, and then we have a chapter in Raleigh as well. I came to North Carolina as a refugee and went to school and got my, I'm not really sure how I found social work, but I found social work, and that's my passion. So, and also I went and to get my MSW and got my clinical license associate. So I'm clinical associate right now, so I'm not fully licensed yet. So I just submitted my paperwork and got my supervisor on board to help me to get, hopefully in a couple years, to be fully licensed clinical person. And also I'm serving as a supervisor for one of our community health worker who is with UNCG Strong Mind. So I'm here, I'm looking forward to learning from everybody here and learning from you guys also in the audience. Thank you for having me.
Thank you all. It is such a privilege to have you here to share your experience and to have all of you in the presence here. We really love to hear from you after we have some conversation with our panelists. So I'm going to start with this question. What do you see as the most urgent needs in terms of AAPI youth mental health? So anyone jumping? Okay, there's no particular order. Yeah.
I can go first. You know, like back in high school, I'm always one of those people who's quiet. Now I'm always like so loud all the time. I got out of that comfort zone. But so with our mental health program, we work with the Kareni in Winston-Salem, the Bhutanese community, and also the East African community. We call them the Swahili-speaking community in Greensboro. So what we have seen with our partnership since the pandemic, the most needs are just like a lot of what you might have seen in other as well, is just the lack of resources, the culturally appropriate resources. So that's why we, as the four partner came together, we're training a lot of community health worker and community leader, churches leader, because faith is very important to us, and churches leader are like the first person that a lot of parents go to or youth go to when they have an issues. And as we all know, with all the stigma, we're trying to make it more normalize it, and that we're talking more about it. And in our community, we struggle a lot with addiction and other type of disorder in the community. So we're trying to work really hard to normalize it where it's okay to talk about that. We host annual youth conference in our area. We do that normally in the summer, and we just did our third one where mental health is always in there. We try to get the parents to come out as well, and just letting them know like, we are here to be of service to you all. Let us know how we can help. That's why we also partner with UNG Strong Mind, so that the community health worker there can provide the in language. So she does like Jirai, Vietnamese, and Raleigh. So we have that services to the community, young people, and the people who don't speak English. And as well, we do a lot of different activity with our youth. We focus on like soccer and different activity, because who don't love soccer, right? We all love soccer. So the Kareni community have a great youth soccer program, and we just started ours this year as well. So because we're not just gonna come out and say, hey, I have a mental health issues and I need help, right? We're not gonna do that. So we all know that. So therefore, we develop these different activities so that we can tailor it to our youth, where at the end of this different activity that they do, and then we have like a serious conversation, more heart-to-heart conversation. So just, I guess like to circle back is like to have more culturally appropriate services that people in your community who can talk to you. I think somebody mentioned earlier in the session that we don't have enough clinical people, right? So with the Kareni community, we have currently one that is currently in the program getting her MSW and doing her internship now. So in our end, it's like we're working in partnership, in collaboration, trying to get more people from the different community we work with licensed, and so that they are professionally trained to work in the community.
That's great. As a researcher, I personally would like to see more data and more research on this. In the United States, we actually have really good data. However, for our population, AAPI, we have maybe only 7% of the population. And even with this 7%, it's diverse, hugely diverse, more than 20 maybe more than 30 ethnicity groups and with different language, different culture. I think any work needs to be evidence-based. So you need to know the situation better, and given this how diverse this is, I think I would like to see more research on this. As the other session mentioned, we AAPI often grouped into the other categories, so we don't really know many of the challenges we face here. So I would like to see more data like the TAAF study that we saw this morning.
I'm just going to add a little bit of my perspective as a faculty at UNC Chapel Hill. So I've been in UNC Chapel Hill for the past 12 years, and I work with a lot of young college students. We talk about 17, 18, 19, very, very young talent student. And you probably don't know, we have quite a large group of international students directly from China, from Korea, from Japan, applying as a freshman to the UNC Chapel Hill. And so some of them work in my lab. And one of the issues that I see, those first generation international young college students, they immigrate from their own country to North Carolina without any family support. The most urgent issue for them is isolation. That kind of isolation is very difficult to describe. Thinking about they have to use the secondary language and they don't have family here. They have to navigate the school work, dorm, and the social life, internship without any support. And so I start to organize social event for my lab. So I invite my lab member, go out for dinner, go out for a hike, go out for a run. And I would like to see more structural support for particularly the international college student that who want to seek better education, and they carry the parents' expectation, go overseas. They may be the first college student go abroad and to study in UNC Chapel Hill, which is for them, some of them, that's their lifetime dream to study in such privilege our Duke University. And I'd like to see that, but right now, our university's support is more in general, not focused on AAPI, not focused on cultural differences that the AAPI student face. For example, if they have the food car that they use to eat the food in the cafeteria, all of the vegetables are raw. And so that's not very feasible for a lot of, especially Chinese students. They first come here, and nobody teach them how to properly adjust their diet culture to the American. And so I like to see more structural support to battle with the isolation and to better support our international college students.
Thank you for your sharing, and I see that, Liana, what you described, the activities are really important to build a platform for communication, which is the beginning of understanding their needs and potentially delivering needs. And I also see, and that's similar to what Grace you mentioned about isolation, structural changes to help with that kind of needs. And definitely agree with Xue Song as well. We need data. And as a researcher, I always want to remind people, we collect data not for publication purpose. That's definitely not the primary reason. We do research because we need evidence. We need evidence so that the data can support grant funding. For example, you all touched upon that. AAPI funding is very minimal. until today. So we need data to support that kind of needs. And we also need data to guide us to develop structural program, any kind of program that would be helpful. So I'm going to jump into the next question. So when you are in a place of conducting AAPI mental health in youth, what kind of challenges do you see or do you experience yourself?
So I've done a lot of community-based study in AAPI group. I would say that one of the biggest challenges is to gain trust from the community leader, and also I do find that as a immigrant, no matter which generation, particularly in North Carolina, AAPI individual, we hesitant to participate in a research, especially public health related research. But like Xuesong say, we really need data to film the evidence-based practice. And during my PhD dissertation, that was back to 2016 to 2018, I was doing everything I can to persuade the community leader to allow me to collaborate with them to study AAPI individual who has a larger body size, to understand what kind of the stigmas experience they receive when they have a large body size, and what those stigmatized experience affect their mental health, particularly affect their eating behavior. And it took me at least 12 months to knock door on door to every different Asian American church, to the grocery store, to the Chinese language school. And to be honestly, some of the leaders really give me a hard time. They are really, not only did they shut the door in front of my face, they insult me. They insult me, say that you just want to, gain some profit. You just want to. I was just a student, but they give me they insult me, say that this is not feasible. You just want to gain some profit, etc. And I keep quiet. I keep trying, and eventually I got almost 170. Asian American individual from North Carolina to participate in my study. And that study helped me to graduate and also helped me to promote the awareness of a stigmatized attitude toward Asian American who have a large body size. So that's just one example. I think that's my personal experience that I feel, it's difficult to gain trust because Asian American, especially if they are not in the academic environment, they normally hesitant to participate in a research as a participant or as a collaborator. But I think that throughout the time, if more AAPI research can be conducted, especially in the North Carolina community, and the more people will see that the evidence will come out from the research, and the more people will trust that we researchers, we do the research not just for profit, it's for the overall improvement of the health for AAPI group. Thank you.
I'll share a little bit. So when I was in undergrad, I started my research journey with some of the professor at UNCG, and we did a research called the Monsignor Hypertension Research Project. So for those of you in the audience who are not familiar, we use the word Monsignor in our community, so we're mainly from the Central Highland of Vietnam. A lot of us got displaced or came to the United States as refugee, and the main community member are in North Carolina. So North Carolina is the biggest population of Monsignor people outside of Southeast Asia for us. And so there's no data or anything in our community. There were books that was written about us by other people. There's really nothing. So they started the journey with the research, and they recruited a lot of students from our community, from different colleges and high school students to join the research, like as a, not participant, as a volunteer and learn about the research. From then on, so this has been it's been like about 10 years or more than 10 years now when we started that research. A lot of our program are based on a lot of research we've done in the past, and that's how we come up with different program, and that's how we're the dream that we have in the future is to build our community wellness center, where a place that we will own. But definitely there were many challenges with come with the research, because a lot of our community members didn't really understand what it was. So I took multiple meeting with stakeholders, community leaders, parents, and stuff like that, and to get participant. And having me, I think I was the research coordinator, where like I was going house to house to schedule the appointment and did the interview with all our participants. But I think being able to do it in language, we had it translated in Jurai, we had it translated in Raleigh. A lot of people, the one that couldn't read, we do verbal translation or interpretation in consent form and other, other things. So those was helpful. But yes, it took a lot of like meetings, explanation to overcome those challenges when it comes to research, since it's so new to our community.
So sounds like you found a way to overcome those challenges. How about Grace? What do you think could be helpful in order to gain trust from community leaders?
I think one thing that we as a researcher have not done enough is the publicity. So I think Lily did a great job. Lily really know all of the channel that how to gain publicity of our work. For example, if you see a local news talk about our research, then that gain your trust, right? Versus if I tell you that this research is going to help the all AAPI group, but if you see the local news talk about it, you see a radio talk about it, when you drive to the work, you turn on the NPR radio, it talk about AAPI research, then that gains your trust. And if you see the social media, if you see the TikTok post about the research result, talk about how important of youth mental health research, then that gains your trust. And you will encourage if you have a friend that willing to participate, then you will say, hey, NPR talk about this research. Would you like to participate now? Right? And so that's one thing that we don't do a lot. And also putting in the writing, in the blog post, in the Facebook post, that also will gain a lot of people's trust. And bottom line is that I think as a scientist, a researcher, we need to find a way to create harmony between the research result we find and our audience. And we need to be able to translate that language to get the support from the general audience, not just from the scientific community, because that's not enough. That's definitely is not our angle. Our angle is to reach general public, and to then when they see the story, they will feel like, oh, this is my story. So I think that's the part that we need to do better.
So what else, Grace? That's a very important point. Research is not just for printed data on the paper only, but for the purpose of really benefiting the community, the individuals. So how can we do better? What are some effective strategies that we can translate research evidence into practical application, practical strategies?
Yeah, I can take this. So after all this hard work from community researchers, so we got this wonderful and credible findings. How to translate those findings into practice? I think the key is to make the information visible and accessible to people who can act on them. The people including policymakers, professional practitioners, and like everyone who are engaged in this effort. And for different groups, it can be different strategies. For example, I so feel what you said, researchers, we have a heart to make our findings public, like make it available to everyone, but we often don't have the practice. And not every researcher is good at this. So I think what researchers can do is partner with organizations like UC Waves, some AAPI oriented organizations to translate our findings into plain, lay, accessible, everyday language, and put them into a go-to place for even translated to multiple languages, so everyone in the community can access it. This is for researchers. Oh, for researchers, I think another thing what we can do is advocate for our community when we can. And for families, I think the most important is education and the support. I know Waves is already doing many of this stuff, like a webinar, discussion group, support group, even book clubs can help parents understand our youth needs more and equip parents with the proper language, some toolkits to normalize the conversation, mental health conversation with our youth. For schools, especially the schools in districts with a higher concentration of AAPI population, it may worthwhile a more investment in formal training for teachers, for staff, so that they understand the unique stressors for our youth better, and they can identify early warning sign and respond in a more culturally sensitive way. And also our youth is among peers. So I think a platform for them to have a open dialogue with other youth, not only from API population, but also from other groups, can reduce stigma and build solidarity. And none of this can happen without investment, funding, and the talent development, and also mechanisms to bring everyone together. And today's event is a great example. I hope that we can have these opportunities on a regular basis.
Yeah. Wonderful. Did you want to share anything about?
What was the question?
How do we effectively translate research evidence into practice? Any suggestion?
So it's not really to answer your question, but I do want to say that I think as students, when I was a student taking a research class, they scare me, like all the words, all the big words, right? I hated it. But I think, as a student, being in this kind of environment, when we're talking about research, it might help us as student back then, like, oh, okay, I can see where you're going with this, I just wanted to make that comment.
Thank you. Now I'm going to turn to last question, and then we'll open the mic for anyone who might have a question for our panelists. So if you have any funding that you need today to do AAPI youth mental health research, what would you do? What would that research look like?
Well, for me, that I would love to see more research focused on eating disorder for the AAPI youth, that including undiagnosed, unscreened eating disorder among our AAPI youth. So when we talk about the term eating disorder, what's popping in your mind? You're thinking about a white girl, skinny, young. That's a very typical stereotype type of eating disorder patient, right? But that's far from the truth. A lot of AAPI youth suffer from eating disorder symptom without even getting screening or diagnosis. And so part of the research about API use in eating disorder is to raise the awareness of the red flag, especially for the parents and the caregiver in the family unit. Because we know very little about why some people develop eating disorder and why some don't. Even though they live in the same household, they experience the same traumatic event, they experience the same stress. And let alone that there are very, very little eating disorder research focused on AAPI use. And we know that if we couldn't discover the problem when they are still in the youth, that problem will just carry out through the adulthood and affect their life for long term. And eating disorder can have a very severe consequence, including the high risk of suicidal ideation and the high risk of depression, anxiety, etc. And so without screening, diagnosis, we really don't know how serious of a problem for eating disorder in AAPI youth. So if I have a funding of the whole world, then I will focus on this particular group for eating disorder and start in North Carolina. Thank you.
For me, the after research, I guess, are the more like a long-term plan. So let's say we do the research for it takes 2-3 years, right? The after, because like for me, we don't want to just do the research and check the box. Oh, we graduated, we got our PhD, right? And we're done. But what's after that? The programming, the giving back to the community. So when we negotiate research with university, we always say, what's the benefit? Like, how is this going to benefit our community? What you're going to give back to us? We're not going to be like you guinea pig and, for you to do research and check your box and done, right? For me, I'm always thinking the after, the programming. What are we doing to support the community? This research could affect, could bring up back trauma things that they had done in the past, right, or didn't get treated, those kind of things. So the giving back to the community is when I have a lot of money. And also, the program continue, long-term program, making sure that the community, whoever we serve, the population we serve, can come back to us. They will grow up, be a researcher, grow up to be whatever field they go to, and give back to the community. Like the cycle continue, right? That's kind of like my dream is of the community center, is like to, for us to grow up, give back, the funding continue, because without funding, we know that like we can't work. We all got bills to pay. Let's just face it. Like right now, this housing crisis, income crisis, basically like wage crisis. People are still getting paid so low, and a 2-bedroom apartment costs at $1,400. So I think just continuing that cycle and to be able to provide the program, also help family along the way with emergency fund. If we're thinking about holistically, we have to think about all the social determination of health, et cetera, et cetera.
Yeah, okay, can I? Yeah, please. If I have funding, I would like to expand what I have been doing with WAVES. First is have a program or some effort to support youth to conduct research among our community. So like observe your peers, your neighborhood, your school, and identify the challenges with the survey, with the focus group, with the needs assessment. We actually have some good examples in our poster session later. So please visit and talk to them. Another thing is leverage what we already know. So different chapters of UCA actually can do this screen and assemble high quality, credible health information, public health information into one place and publicize it, promote it, make it accessible to more people. We can even participate in data analysis by ourselves. As an example, as a volunteer for UCA Data Center and UCA Waves, I've been mentoring youth to examine mental health issues with a focus on AAPI population. This summer, my students used the CDC high school youth behavioral risk factor surveillance system, and they are going to present their findings later in the poster session. We have one on suicide ideation and attempts, one on social media use and cyberbullying, and another one on cigarette and e-cigarette smoking. So please stop by and talk with them. And later this year, we are also going to present additional data on the American Public Health Association conference. And we also hope we can translate these our findings into daily language and disseminate it through social media like WeChat. Yeah, that's what I would like to do.
Great, great. Yeah, all wonderful, wonderful things to do. And personally, I would like to add a little bit of my own thought. I did a cross-sectional survey a few years ago in this triangle area in the Chinese community. And a very interesting finding from that survey was that there was a very extremely significant correlation between the difficulty of parent-child communication difficulty and depression and anxiety scores. So it's a correlation. I cannot say, conclude whether one leads to the other or not. So I would like to research and more to understand about if there's a cause-effect kind of relationship. And it potentially could be a very dynamic, it could be a two-way street. It may not be just one way. So that's what I would like to do. And from that survey, I also found that eating diet quality, this, Grace, you might be interested, knowing the diet quality, for example, more eating out actually is also related to higher depression and anxiety scores. So that's something that I personally would be very interested in doing more, because we all know that our genes have not changed, right? Our genes have not changed for the past many, many, many years, but how come we are seeing so much more, not just physical illness, but also mental illness? So what's going on in our environment, in our lifestyle that's causing that? It's, you know, there is a great need to understand more. All right, I'm going to open the mic for anyone who might like to ask question of our wonderful panelists. We have a few minutes for you to do that. Any questions from the audience? Yeah, there's a mic over here.
Thank you so much. It's a wonderful presentation. You brought the evidence. I'm Dr. Sujia from North Carolina Central University in the nursing department. Being an academician, researcher, and activist, and all those things. I agree, the points what you have shared. Yes, definitely, we need a lot of publicity, lot of informal discussions and meetings and other things. Coming from Indian background, it's a similar culture. So we hesitate to talk, and there is a generational gap, and there is a discrepancy, the expectations. The younger generations are really facing a lot of challenges because they have to adjust to different cultures. And being parents, we are not very open, and we are restricting some of those things, and we put all our dreams into the younger generation. So that way, it's a lot of our youth are facing a lot of problems. So they have to come out and speak, and So I feel in the school and colleges and other places, we need to have safe space. Like in North Carolina, we have some of those things, like our counseling department. We conduct a lot of programs, like mental health first aid, QPR, suicide prevention. We call it as a guide training, stress first aid. We do a lot. But how many of us are coming forward? Whenever you see this kind of programs, see, today's session is free. They're providing lunch, breakfast, everything, and parking is free. In spite of that, look at how many people are presenting, how many are here. So we have to have more publicity and more openness. So it takes time. Definitely, we should not lose the hope. So we should continue what we are doing. So I really appreciate the way you have brought out some of those things. Like as a researcher, you got something from the public. So you have to give back. So I appreciate you are continuing the programs. For that, sustainability is needed. Sometimes we need funds. Some funds, we may not get it. Now things are changing, but whatever we are getting it, not for everything the funds are needed. Maybe we can have some kind of webinars or some kind of informal sharing in the social media. It doesn't need much of the money, so we have to encourage those kind of things. And mental health, we need to change the perspective. As you know that physical health is important, mental health is equally and important. So I really commend Dr. Chen. She is one of my colleagues. So her leadership and all the UCA waves, everyone, whosoever have come for today's session. So I really appreciate, and I commend your coming over here and then sitting here and listening. And definitely there will be a lot of changes. I appreciate the posters, what you have made it. So I want to share the posters, what our students are doing. I worked with the high school students. So they are sitting here. Can you raise your hands? Just I want to acknowledge them. So 3 of them, they're doing it, from high school. Their parents agreed. So we have taken up the responsibility. So they're here. And one of my pre-nursing student is here. So we are doing some posters, and please look up. So what we brought is in a different way, like not the problems. So how our culture is bringing, like how our culture is enriched, which helps in mental health. Because we need to continue our culture, and we need to find out the resources which are tailored to our culture. So the posters are going to share that kind of information. So we need to know the resources and how our culture, we need to continue, because many times we see different cultures and we are leaving our own culture. So we should not do that. And I agree with you, the eating aspect, eating disorders are definitely one of the problem. And anxiety and depression, yes, definitely they are there. But there are other ways, like we have a lot of strength. So I'm a positive person, I talk about positiveness. Yes, we have the strength, we have the culture, we have the community. So let us bring out our strengths. Thereby we can continue. That's all I want to tell, and I commend each one of you for doing all the wonderful work. Thank you, everybody. Thank you for listening to me.
Thank you. Thank you for your encouragement. You're doing wonderful work also. Thank you. Any other question or comment? Please come forward. Yes, please come forward.
a little short for this. Hi, I'm Bethany Cho. I am a graduate student in clinical mental health counseling. And as somebody who is interested in research and is aware of the changing landscape that we live in, I was wondering how you guys are thinking about continuing to be proactive and knowing how important this work is, sort of, I guess, looking to the future. How do we continue our work in a situation where some of these initiatives are not seen as useful? I guess I'd be interested in your opinion on that.
This is such a wonderful question. I'm really hesitant to respond. I don't want to get any wrong impression, but I absolutely agree with you. One thing that I will say is that right now it's extremely difficult to get any type of funding, especially for AAPI group. If you label your proposal as AAPI, it's very difficult to get any funding. And so what we as a researcher, how we proactively move forward is to, like the participants said, we recognize the problem is still there, but we also recognize our strength. Our strength is that collectively, we are better together, working together to move the science forward. And what we did is that we still continue to work together. Bawa and IDD, we still work together, but we don't give up the hope. You know, we don't give up the hope about moving forward our work, because the work has to continue. And one good mentality is that we believe that we have to carry out the research work focused on AAPI community with or without funding. So there are ways that we can do it without funding, or with very minimum funding, but has a huge impact by advocate our research resource. But yes, I agree with you that right now the atmosphere is not the most optimist, but the hope's still there.
I just wanted to make a comment. I love the previous comment. Thank you so much for all those positive encouragement. And yes, let's give it up to all the young people in the audience, you guys, because you guys are definitely sitting here and listening to us, blah, 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 right? But I guess not in term from a research perspective, but a community-based organization is for the professors to continue to work with that community organization and not just finish and done and gone. The professor that we work with, like I said, we started our research project 10, 15 years ago. We still have that relationship. Now they're mentoring other young people in different group. Like we have a couple of students, one of our students because of the professor's hard work and getting funding, she has a full ride to her master's program in MPH. You know, just continue to working with those community and not let that relationship go. So there are other future opportunity that come, even though we're looking for big funding, but sometimes anything small, anything that will help the student in the future, that where they go, you know, to help them with their education as a stipend, and also that's when they graduate, they give back to the community. I think this continue that relationship as professor and not just finish and then move on to the next thing.
Yeah, I agree with Grace. There is hope. It's not impossible to get funding. And for example, the project that Grace mentioned, we're working with Lily on, is a funding from Blue Cross Blue Shield. So there are private foundations that potentially could support this kind of research. And that funding was for the AAPI community specifically. And it's not impossible to have federal funding either, knowing that it's challenging, it's hard, but it's not impossible. And I think that's another reason that we need to continue to do some work, contribute some more data so that we could advocate for ourselves, that we need to do more research. Resilience, yeah. That's the bottom line. We need to have resilience to carry on. Yeah, thank you for the question. And it is a very important question. Yeah.
Hello. My name is Isabel. I'm coming here from Baltimore, visiting from Hopkins, from Johns Hopkins. And I had a question regarding like study recruitment and recruitment strategies, especially for minority representation in studies. Even the poster I brought today talks a lot about how there's a lack of representation in studies, and it's not for, a lack of trying, at least from my perspective. I think that oftentimes, especially recruiting from an institution like Johns Hopkins, which has impacted minority communities around it in the past in negative ways, it can be difficult to recruit from minority populations. And I was just wondering if you guys had any tips for a research coordinator like myself in how to bring in more minority research participants so that our research can be more representative of other cultural groups.
Any of you? I think the trust with community organization is a very, very important part, and collaborate with the community organization. So you need to establish a relationship with them first, and then have open discussion, even education. I work with a group at Duke University. It's mostly geared toward African American communities, but they spend tons of time and effort in educating both ways. So the community organizations need to educate the researchers. Researchers also need to educate the community organizations about what research is about. And so both need to communicate and to understand each other. And I think from the researcher's point of view, also need to adjust sometimes, adjust our strategies, our study designs, and even data collection, et cetera, et cetera. So I think it's the dialogue that is really important. You need to establish that dialogue so you might gain trust. And then there will be collaboration. And then your recruitment will be much easier after that.
Yeah, thank you.
Just to share, I think what works for us when we did ours, like I mentioned earlier, we have a lot of students from our community who was a part of the volunteer group, and they were the researcher. Also, we did a lot of, beside the people who don't go to church, we did a lot of churches outreach. We get the churches leader involved. We went over the question with them before we even launch it to the participant, like, is this question appropriate? So they had a lot of input in the questionnaire because, we wanted to make sure that it's culturally appropriate, and a certain question might be too sensitive that people are not going to answer if we want an honest answer, right? So I think for us the main important was to have the people in the community, train them as researcher, and also the church's leader and other leader was involved in the questionnaire that we had. So that was helpful for us to make sure that we're not causing any harm to our participant, and when we do launch those survey back in the day.
Thank you.
Yeah, it's not easy, but it's not impossible. And I think it's a long-term relationship that you're building, and it definitely will bring helpful outcome.
All right.
Yeah.
Thank you so much. I appreciate it.
Sure.
Yeah.
Thank you.
Hi, thank you so much for this very helpful session. I'm a high school teacher. I'm also a high school DI practitioner. And I know there's a session on bringing the mental health awareness to the public school systems today. I'd love to work with the researchers, you guys, and any experts sitting in the audience with our private schools in North Carolina. I'm from Durham Academy. My school is one of the 3 founding schools of the Triangle Asian American Alliance conferences that started 3 years ago. So every year, a group of the private school educators, we get together and we host this AAPI-focused diversity conference for both students and faculty members. from the Triangle area independent schools. So we'd love to invite you guys to come to us, to give us a workshop, to give our students the talk, to work with affinity groups in each of our schools. And I heard that nowadays it's really hard to get funding if you mark anything that is marginalized groups, or if you try to even get to the point that you're categorizing a group of people by their race. Most of the independent schools in North Carolina, we're still very grounded, we're still committed and devoted to DEI work. And we have the funding to fund something, maybe not the whole research project, but we can co-host some conferences focusing on AAPI research and activities that we can bring to our students in the K-12 system. In the DEI field, a lot of the DEI directors, assistant directors in the independent schools in North Carolina, they're majorly from African American background. So far, I'm the only one that is not from that category. A lot of the topics we're talking about are still also very, very heavily based on black and white. So the AAPI population, we are often left and being ignored, being not focused a lot in those conferences, in those conversations. And that was one of the ideas we started that conference 3 years ago. So we want to maybe next year or in the future, we can emphasize a panel, emphasize a part of our focus on the mental health. Thank you.
Wonderful. We would love to, yes, let's connect. Any more question?
I would like to representing with volunteers to thank all our panelists. Let's give them a last round of applause.